thank you both for joining us today, Dr. Cassidy and Dr. Carr. We're going to find out a little bit about your scholarship and what you're doing here at OCU. So first, I want you to say what your role is here at OCU.
Sure. Well, I work with the community class, community health nursing, and spend a lot of time there as well as in the simulation center and a few other classes. This project was related to community.
Wonderful.
I am a faculty member here at Kramer School of Nursing with Dr. Carr and also the director of the Minder Simulation Center.
Wonderful. So tell us a little bit about this scholarship project.
Well, this project is related to poverty and identifying with students and for students how that impacts health of a client in the community or in a healthcare setting. And we moved into that because of the COVID-19 pandemic, which was a need to maybe do something different in terms of our clinical.
So currently at Kramer, all of our clinical courses, which community health is a clinical course, spends time in simulation, in the simulation center, hands-on environment. It's very structured to meet certain outcomes for each course. And when COVID hit, we were given 1 week to shift our entire clinical curriculum from hospital settings and community settings into a completely online virtual environment. And so it was myself collaborating with each one of the faculty members, coming up with exercises and programs and games and things that would meet those outcomes in order for our students to graduate. And so through that research, we came across this wonderful virtual platform game that we used during COVID. And then we actually had to continue that in the fall semester after COVID because even though our hospital partners opened up to our students, our community partners had not. And so we were still continuing a virtual environment, and it really had us thinking, we're getting such great feedback from students. This is a good opportunity to maybe research to see best practices and should we continue or tweak and really explore what our students were experiencing. So of course, like all researchers, jumped into literature and we really discovered that this had not been explored in literature.
The community class covers a lot of vulnerability in terms of clients in the community that you see, and we cover that in the didactic portion, but also in the clinical. They're usually going to sites where they're dealing with people who are low income or maybe persons who have disparities and able to access health, rural health communities, migrant communities, homeless populations, and so we weren't able to see that anymore because we weren't going to clinical. And so trying to weave in what we were doing in the didactic portion in terms of how can we then move that into a virtual format. And so that's when we found this simulation online, it was just perfect. And as Dr. Cassidy said, when we started using it, we had so much feedback from our students that said, this is meaningful to me. And as we looked at, maybe we need to evaluate how this impact is impacting students and then their future career in terms of how they perform healthcare for clients in the community or in the setting where they're working.
Great. So where was this presented?
We presented this first at a nursing diversity conference that was a virtual conference in March of 2021?
Yes.
2021?
And it was a
running together.
Yeah, it was a podium presentation.
Yes.
For that.
Yes. And then we also presented this at ONA conference, the Oklahoma Nursing Association conference, in October as a poster presentation.
Wonderful. And how does this project, you talked a little bit about, but how does it directly impact the OCU classroom?
It's different a little bit now for this semester. So since we've gone back to clinical and the students are in that clinical setting, we still cover this content in class. As I said, we cover rural and migrant and poverty and homelessness and all of those concepts. So I've taken that and just moved it into the classroom setting as an activity there so that we don't lose, since we're going away from the virtual clinical, we don't lose this content piece and this richness of this experience for students?
So a little bit about what they do during the game or the simulation, now that it's in theory. They have to log onto this website, and it's a 30-day scenario, and they're given so much money at the beginning of the month, just like anybody would with a paycheck or budgeting, right? And so they have all these life events that start occurring, and they have to make really hard decisions, the same decisions that many of our clients have to make, as far as keeping the electricity on versus letting their health go down because they can't buy their medicine or things like that. And so as a group, they are exposed to situations maybe they didn't come from themselves, or we've even had students talk about, I'm really glad my peers got to see what I went through growing up. And so it's also them connecting together, and they get to have these rich conversations, they get to make joint decisions, and then they see how the month plays out.
And as we all know, sometimes you get surprised, so you have something that comes up that you really didn't expect, and there's this conflict of values that the students have identified that, I don't like this choice. I don't really want to, have to decide whether I'm going to send my mom $100 to help her pay for her medicine, and then I don't have enough money to buy groceries.
One of the themes that came out of it was activism. The students really were internally and externally motivated to do something about it in their nursing practice after they graduate. And I do know that Dr. Carr does a great job of the students then go out and actively identify community resources here within the communities they live in, so they can easily incorporate that into their nursing practice as part of that activism. So I think us doing the research, the themes that came out of it, just made us more aware of what we need to capitalize on in those conversations with our students.
Okay. Well, thank you for sharing with us today, and hopefully we will see you around campus.